Hi, this is Dr. Donovan Christie. I am the medical director and founder of ANWAN Wellness Medical Center. And I'm here to talk to you about our annual 12 Weeks to Wellness program. The 12 Weeks to Wellness program is not just a weight loss program, even though most patients or participants who enroll, they enroll because they're trying to lose weight. We all know the bad effects of obesity. Obesity can lead to hypertension, diabetes, hyperlipidemia, which is high cholesterol, as well as cancer. Obese people are at increased risk of developing cancer, particularly breast cancer in women and colon and prostate cancer. So we understand the need for a patient to be in an ideal weight category because obviously you reduce the risk of disease. So our 12 Weeks to Wellness program not just focuses on a rapid weight loss. What it does, it teaches the participant how to eat throughout their lifespan. So it is a lifestyle transformative program. So most people will go to a rapid weight loss program, which would include a diet that's not sustainable. This is not what this is. If you're looking for that, then the 12 Weeks to Wellness program will not be what you need. So let me go through the elements of the program. So the first thing that you want to do is to find out exactly how much fat weight you need to lose. So we do a body impedance analysis named BIA. That is included in the program. It's a free test that tells you how much body fat you have, how much muscle, how much bone, and what your total body water is. So that's done. We look at that and we know that a healthy body fat percentage for women is somewhere around 24 to 27%. For men, we're looking at men to get to around 18% body fat. So based on that, we then calculate how much fat loss you need. So a BIA is done initially. Now that you know that, we'll decide if you have to lose more than 30 pounds or less than 30 pounds. If you have to lose less than 30 pounds, I recommend our natural carbohydrate eating program because food is 75 to 80% of weight loss. So if you're eating unhealthy food, particularly processed foods, high carbohydrates, high starchy vegetables, you will continue to raise your insulin and gain weight. So 25% of weight loss has to do with activity. Most people are surprised with that because our patients will tell me, well, I'm gaining weight because I'm not exercising. That may be the reason, but it's not usually the reason. Most of the time, it's from eating too much sugar or processed carbohydrates, which raises the insulin level and causes the body to store fat. So exercise is the next component of our program. I will outline for a patient what they need to do on a daily basis. We recommend minimally 5 days of exercise, as well as minimally 30 minutes per day throughout the program. The program is 12 weeks long, so you will have 2 days off during the weeks where you will not have to exercise. We recommend at least walking, though, for 30 minutes. Other exercise that's not a lot of weight bearing, especially with patients that are overweight, is the elliptical machine, a stationary bike, swimming. Those are all good cardiovascular activity for patients to increase their metabolic rate and to reduce their calorie deficit. The third component of the program is the weekly coaching session. That's probably the first and the most important part. You will be given access to a Zoom call, and all your questions will be answered throughout that Zoom meeting. It's 1 hour per week. You don't have to stay the entire hour. But if you have questions, I strongly recommend that you log in and you ask questions. Typical questions would be about, can I eat this? Can I eat that? Am I doing this particular activity correctly? And so on. The third component, which is the third most important thing to health, has to do with how you manage stress. Stress increases hormones in the body, adrenaline and cortisol, which has an adverse or bad reaction on the body. Cortisol will allow the body to hold on to sodium so you can swell. Cortisol gives you sugar cravings, it raises your blood sugar, and adrenaline can raise your blood pressure. So managing your stress through meditation, through relaxation techniques, deep breathing techniques, yoga, chiropractic care, massage therapy is all very important part of this program. So the 12 Weeks to Wellness program starts with a detoxification. We call it the 7-day detox, where you're eating foods that are not inflammatory. They're healthy foods, and you're drinking a shake or a protein drink made from plant-based protein, and the amino acid that helps to heal your gut and your liver is called glutamine. When you do this detox, you're preparing your body for fat burn. The detox will cleanse your liver, it will cleanse your kidneys. So you follow this eating plan the first week. You can eat meat during this time. It's not a vegan detox, but it should be organic. And we recommend the first 2 days of the detox, no meat, just the protein drink 2 times a day. That gets the body prepared for fat burn. After the detox, other things that we strongly recommend are fat burner injections weekly. You can either purchase the vial and do it yourself, 1 shot per week, or you can come into the office and we'll gladly administer it. The fat burner shot is made up of vitamin B12, as well as 3 amino acids, methionine, inositol, and carnitine. Those amino acids, once again, helps the body to burn more calories. It increases the body's mechanism of getting fat out of the cell and turning that fat into energy and eventually weight loss. Other patients will be using a GLP-1 agonist, which is called Semaglutide. It's been well known that the GLP-1 helps the body to lose weight. And how does it work? It works by giving you a feeling of early satiety. So when you're eating, instead of eating a large portion, you're more likely to eat a smaller portion because it reduces the amount of food that's going from the stomach into the intestines. We call that medicine decreased gastric emptying. With a fuller feeling, you're taking in less food. So this is what it's about. Eating the correct food and eating less of it. With activity, you then burn more calories, and that's how you shed pounds. With the 12 Weeks of Wellness program, we're expecting every participant to lose between 8 and 12 pounds per month. So you're looking at a maximum of about 36 pounds over a 12-week period. Most people can become healthy after losing 36 weeks, but it's what you're learning through the process. You're learning how to choose your foods. You're learning how to stay away from processed foods. You're learning the benefits of exercise. You're learning the benefits of stress management. So with the aids, the fat burner injections, and the semaglutide, we are guaranteeing that you will lose at least 30 pounds over that period of time. So come, click the link, join. We're rolling out the program on January 18th. You should get your detox kit first. So you do that first week of the detox, and you'll be meeting with me every Thursday at 3 p.m. 3 to 4 p.m. You log on and get healthy. Thank you.